mercifully, sudden death in athletes is a pretty uncommon problem. But you do hear of a young sports person dropping dead now and then. It has been found out that most of them have an underlying cardiac disease. The commonest probably would be hypertrophic cardiomyopathy. There are aberrant coronary arteries and also myocarditis. Now, these are technical terms which you will not be aware of, and I do not want to elaborate on these. But over the past few days, I have been wondering, how will children play in a post-COVID-19 world? How do your children or your grandchildren go out and play football or cricket? Do they wear masks? Do they stand 6 feet apart? In fact, where would Dhoni crouch behind the stumps? Would he crouch 6 feet behind the stumps or 6.5 feet behind the batsman? That, you will agree, would make both Kuldeep Yadav and Ashwin quite ineffective. And where would the slip fielders position themselves? Does Kohli stand 6 feet away from Ajinkya Rahane? Now that would leave a very porous slip area. So you understand the difficulties. In the same manner, how do you play football? How do you defend yourself, or how do you go beyond the defender without going 6 feet away from you? Now these would be practical problems in the coming years and in the coming times. In athletics, how do you run the 100 meters? Do you keep the lanes 6 feet apart? That would be impossible. Or do you change the architecture of the tracks and the stadiums themselves? Again, a very arduous task. So how would you go about all this? These are questions that have to be raised, and we have to answer them. We have to tackle them now while we sit under the lockdown. The lockdown will be lifted maybe weeks from now or months from now, and then we have to grapple with these practical problems. Some sports can carry on. Tennis, badminton, table tennis, gymnastics, even archery and shooting. That should not be a problem. But any contact sport will be a huge problem. You cannot do a cross country by staying 6 feet apart. The competition gets diluted. It again is an impossibility. But the Germans have done something fantastic. They have launched their football league yesterday. The Bundesliga has begun. They had a match yesterday, which was a strange match because there were no people watching it. The stadium was empty. A goal was scored, and we had this classic situation wherein the players were rejoicing standing 6 feet apart. No hugging, no screaming, no jumping around. This is the new football for you. And this is the Bundesliga. What you do not know is that the chief coach of one of the teams was banned from being in the stadium. I think his name is Heiko Heglisch. Now, Heiko Heglisch made the cardinal mistake of going out from his hotel to buy a toothpaste, he says. Now, that has landed him in a quarantine, plus the penalty of not attending to his wards. That is his football team. And he will resume activity after he is tested twice negative for the coronavirus. And I understand that the virus is or can be dangerous, it can be deadly. But I have been highlighting repeatedly for the last almost 2 months that the mortality is not very high. And mercifully, again, the Chief Medical Officer of England, Chris Whitty, has echoed what I have been saying publicly. You can check that out on YouTube. He also has said that almost half the people who harbor this virus do not realize they have the virus, which means they are completely asymptomatic. Of the remaining half, 80% have mild symptoms, which do not warrant going to a hospital. Of those who get to the hospital, 15 to 16% can be tackled by oxygen alone. It's only about 5 to 6% who land up in the ICU. Now that is very reassuring by Chris Whitty, because the English and the British management has been saying repeatedly that the virus is a very deadly stuff, especially after that peculiar model presented by that gentleman from Imperial College, Professor Lockdown. Now the point I'm making is that we have to decide whether the children go out to play or not, whether they play with masks on or without the masks, how do they stay 6 feet apart, do we wait for a vaccine? Now how long can we wait for a vaccine? Now a vaccine sounds very nice. It sounds very nice that a vaccine is effective and is the answer to our problems right now. But what you must realize is that a vaccine is not a magic bullet. You see, HIV has been with us for more than 3 decades. It has killed more than 3 crore people. That is, 30 million people have died because of HIV. Even today, we have no vaccine for HIV. We have no vaccine for malaria. We have no vaccine for tuberculosis. Tuberculosis kills 3,000 people in one day. Please understand that coronavirus has not killed 3,000 people in India over the past 5 months, whereas TB kills 3,000 people in one day itself. TB kills 1 million people, 10 lakh people in a year. But we have no vaccine for it. We have no vaccine even for dengue. I mean, an effective vaccine for dengue. Dengue is what we pronounce as dengue. We have information that a company is racing to make this vaccine. The company is an American-based company. It is called Moderna. It is using the latest technology. This is the messenger RNA technique. Now you must understand that Moderna has never made a vaccine before. The method it is going to employ is that it will inject you with a vaccine that contains a messenger RNA. The messenger RNA goes to your cells and coaxes or orders your cells to produce bits and parts of the coronavirus, not the entire virus. The company claims that by producing bits and parts of the virus, for instance, the spikes of the virus alone, the parts produced are not toxic for the human body, but are good enough to elicit an immune response, an adequate immune response. It has been bandied about that this virus will be available within the next 4, 5, 6 months, maybe by September, as early as August. Now, I find that very hard to believe because a vaccine takes years to develop. It has to be tried in animals, then in human volunteers, and then one has to look out for side effects, serious side effects. Though, of course, these are very, very uncommon, they are rare, but there can be paralysis, there can be epilepsy, there could be cancer. Now, these are serious things which have to be ruled out before you employ a particular vaccine. Now, that holds good for this particular vaccine also, the COVID-19 vaccine. Despite what everyone says, that the vaccine will be would be the answer to all our problems, I am still skeptical. But that does not mean that I will not take the vaccine myself. If I know the vaccine is effective, I will take it. But the point is, do we wait for this vaccine to develop? And for how long do we wait for this vaccine to come about? In the meantime, JAMA has published an opinion piece by 3 sports cardiologists who have relied heavily on the guidelines presented by the American Heart Association 5 years ago. The opinion rightly says, again, that the problem is we don't know who has had COVID-19. So how do we figure out when to resume athletics? The situation is simple. If a person develops serious problems, he goes to the hospital, he is managed, and we know this person has had COVID-19. Now we can wait for 6 months, and then we can, by doing a battery of tests, make him eligible to resume sporting events. He could be a professional athlete, or he could be a leisure sports person. The problem is that if a person has had COVID-19, and has been asymptomatic. How do we tackle him? Now that could be a problem. Anyway, the effect of COVID-19 has been profound in patients who have been hospitalized. It has been found that as high as 20 to 25% people do have cardiac problems. They have a variety of problems. They could have ischemia, they could have arrhythmias, they could have myocarditis, they could have pericarditis, and even myocardial infarction. They always have ECG changes. Now this is a problem. If you have a patient who has developed cardiac problems and who is an athlete who wants to get back to running or playing football or playing cricket, how do we manage him? So the opinion piece, as I've mentioned, relies on the guidelines made by the American Heart Association 5 years ago, published in circulation. And these guidelines are simple. What the guidelines suggest is that a person who has been suffering from a viral myocarditis should, after 3 or 6 months, be checked again. The tests mandated are an ECG to see that the changes have resolved, an echocardiogram that shows that the heart has normalized, the ejection fraction is normal, the inflammatory markers like CRP, ferritin have normalized, and the biomarkers like troponin and NT-proBNP have normalized. A cardiac MRI would be helpful, but I don't think that would be practical. I should also tell you that we still are not very clear as to how exactly the heart is damaged by this virus. It is unclear whether the virus attacks the heart muscle directly or indirectly by producing an inflammatory state, or by damaging the blood vessels, or by producing a procoagulant state, which means that the blood is more liable to clot. These matters are unclear, but the fact is that 1/5 of patients do develop cardiac problems. So, to sum up, we will have a problem later on as to how to get back to playing. Playing is an essential component of human life. Sport is civilization. You cannot lead a life without sports. So I am still not clear as to how to get back to sports in the most effective way. Playing a football game in the absence of spectators is not and will never be the real thing. So we probably will have to change our approach. Thank you very much.